You have probably had people say when you go into labor, you will just know. But here is the truth, sometimes you don't. In fact, early labor can feel just like period cramps. And for many first time moms, they rush to the hospital only to be sent back home. That's the reality that nobody really tells you about. Today, we are going deep into what really happens during labor and delivery. The stuff that does not always make it into your batting class, nor all those dramatic movie scenes. Before we start, let me just say this and make it very clear that I am not a doctor, nor do I have any medical expertise. This podcast is for educational and informational purposes only. Everyone's body and pregnancy journey is unique, so please do consult your healthcare provider for advice, diagnosis, or treatments which are specific to you. With that said, let's get into it. Labor isn't one long blur of contractions. Medically, it happens in three stages. The first stage is usually early labor. This is when contractions start, but they may be irregular, anywhere from 10 to 20 minutes apart. They feel like period cramps or sometimes even backaches. The cervix begins to thin during this period and they dilate up to about 4 to 6 centimeters. For first time moms, this stage can last hours, even a full day. And then you have active labor. This is where things get very intense. Contractions begin to be stronger, longer, and closer together. The cervix dilates from around 6 to 10 centimeters. On an average, this stage lasts for about 4 to 8 hours for first time moms. The pushing and delivery then comes. Once you're fully dilated, it's time to push. The pushing stage for first time moms average about 1 to 2 hours, though it can be shorter or longer. For instance, my pushing stage was about just 5 minutes and my baby was out. Sometimes it takes up to 1 to 2 hours and then the baby is born. You then have what we call the delivery of the placenta. After your baby is born, your body still needs to expel the placenta. This usually happens within 5 to 30 minutes, and you can have mild contractions during it, according to the American College of Obstetricians and Gynecologists and the Mayo Clinic. How long does labor actually last? Well, movies make it seem like your water breaks, you're rushed to the hospital, and boom, the baby is here. But the reality here is that the average labor for first time moms lasts for about 12 to 24 hours. For moms who have given birth before, it's often shorter for around 8 to 10 hours. If you're induced, it can even be longer. Since your baby is being, let's say, nudged into labor artificially, that's why it takes much more longer than the normal or regular delivery. But here is something that's very surprising. Only about 10 to 15% of women experience their water breaking before labor starts. So for most, contraction actually comes first and then the water breaks later. Sometimes that happens like when you're already at the hospital. Labor is often described as one of the most intense physical experiences a woman can go through, but it does not really have to mean unbearable or even suffering. You do have options. One option that's very common is the epidural, and that's a very common pain relief method here in the US. It numbs the lower half of the body while you remain awake. It does not always remove the pain completely, but it makes it a little bit manageable. The pros of an epidural are that it is very effective and it helps mom to also get some rest. But the cons here is that it causes temporary drop in blood pressure and it may prolong pushing and increases the chances of most times needing intervention like forceps or vacuums. There is also IV medication. So these are given through an IV or injection and they can take the edge off, but they don't eliminate pain. They also cross the placenta, so timing is very important. Then you have what they call the nitrous oxide, also known as the laughing gas. It is used more commonly in the UK, as far as I know, and many parts of Europe. It helps with anxiety and pain perception. It also helps you a lot to just be relaxed, but it does not like fully block pain. However, you need to know that there are non-medical approaches too that you can actually do. Some of that is like breathing techniques, movements, batting balls, hydrotherapy, that is laboring in water, massage, and hypnobathing, which is also very good and it makes a huge difference. The right choice really depends on your health, your hospital, and your bathing preference. So when it comes to medical intervention, here is what you should know. Sometimes birth does not go according to plan, and that's okay. But it's very important to understand that interventions may actually come up, and one of those can be induction. So labor is sometimes started artificially using medication like pitocin or physical methods like breaking the water. But reasons may include, for instance, overdue pregnancy, high blood pressure, or concerns about the baby's health. Induction can actually make contractions longer and more painful, which often sort of like lead moms to request an epidural sooner. There's also the C-section. In the US, about 1 to 3 births is by cesarean section. Some are planned and some just happen after labor starts if complication arises, like stalled labor, fetal distress, or placenta problems. Recovery from C sections usually will take longer since it's a major abdominal surgery. There's also what we call assisted vaginal delivery. Tools like forceps or vacuums may be used in pushing, or when the baby needs to come out, they can also use vacuums to get the baby out safely. None of these interventions mean you have failed. They are medical tools designed to keep both mom and baby safe. But here's the part that almost never makes it into the movies or the glossy maternity ads. After delivery, the placenta, your uterus starts shrinking down, which causes afterbirth contractions. This can be especially strong if you breastfeed because oxytocin triggers your uterus to contract. You also have vaginal tearing, which is very common. Around 70 to 80% of women have some sort of tearing, and many need stitches. Recovery can be sore, but pain usually improves within weeks. If you had a C section, you'll be dealing with incision, pain, limited movement, and a longer healing time. Postpartum bleeding, also called lucia, I might be saying that wrongly, can last for about 4 to 6 weeks. It's heavier than periods at first and it gradually lightens. This reality does not make birth any less beautiful, but they sort of like prepare you for what's ahead, and so that you're not really blindsided when you go into the labor room. So you need to know from this episode that labor is unpredictable and every birth looks different. You need a bad plan, but which is helpful, but you need to also be very flexible, which is key. So you need to also know the pain relief and intervention options before labor starts, because knowledge is powerful. And remember, bad isn't just about getting the baby out, it's about protecting your health too. Labor and delivery is one of the most powerful experiences a woman can go through. It's raw, it's messy, it's emotional, but it's also a moment of incredible strength. That is it for today's episode of Motherhood Unfiltered. Remember, this podcast is for informational purposes only, and it is not a substitute for medical advice. So please always consult your doctor or midwife about what's right for you and your pregnancy. If you found today's episode helpful, share it with another mom to be. And don't forget to subscribe, because next week I will be talking about baby milestones, where I'll be discussing what's normal, what's not, and how to stop stressing about the comparison. I'll see you then.